have brain surgery. When can that happen?
So yeah, brain surgery is something that is an option for a number of people. We try to identify who might benefit from surgery as early as possible in the course of having epilepsy. And determining a person's surgical candidacy is an important task of what the neurologist should be doing. In general, if you don't respond to the first or the second medication, then you would be moving into the area where we'd be thinking, maybe there's another approach here. If you come in and have epilepsy and there's an obvious reason for it, a brain tumor or some other cause, an old scar from an injury that happened long ago, for instance, then you may move towards a surgical approach even earlier in the game. But if you're generally coming in and we don't really know why you have epilepsy, which is the majority of people, and there's not an obvious cause on your scan or somewhere that we could say, okay, that's going to require surgery, then it would be a matter of trying a med or two, seeing if you respond to them, and if you don't respond, then addressing the question of whether there's a surgical option. Unfortunately, the surgical option is not there even for a lot of people who fail the first couple of medicines. And establishing surgical candidacy is a process that we go through a lot of testing, a lot of evaluations, in depth, looking at your brain and trying to figure out if we would help you as opposed to help you and potentially harm you by addressing it with surgery. So it's a long process. Takes a couple of years for most people before you get to the operating room. And along the way, obviously, there's always the possibility that it will be in a place that can't have surgery done on it in terms of where the seizures are coming from. Or maybe a combination of other medicines will help, and we'll say, okay, really not the right time to do it. In terms of the timing of epilepsy surgery, the bias in the whole field has moved towards the earlier the better. So if you are a surgical candidate, getting that established early in your life and moving towards surgery is a good idea rather than waiting the 20 or 25 years that in general is what happens today.